let's talk COVID. Let's talk COVID. COVID's back, apparently. I mean, look, it's something that we're going to have to survive with and live through for many years. But there's a new variant that's coming through the States. There's let me just skip through a little bit. There's this article, there's this episode that Stephen Crowder talks about in response to I'm going to take a little bit of a sidebar for a moment. I find this quite interesting that Stephen Crowder's got this video that he's talking about the new lockdowns and new everything like that. And YouTube has put under his video information from the WHO about coronavirus. So that's obviously their way of trying to come against their so-called misinformation, because they've now pulled their restrictions on talking about it and stuff like that. But I wonder if they're going to pop back again. Well, let's talk about this. So COVID restrictions are back because there's a new variant. There's some universities. There's some organizations that are now reintroducing mask mandates and stuff like that. And links in description. Stephen Crowder talks about the issues and what's going on in depth. I don't actually necessarily want to talk about it because we're not a political show. We are a leadership show, and we want to talk about leadership topics. And so, Dr. Rod, we're talking about following people into battle, whether that be following into persecution. There are two very big camps when it comes to COVID and lockdowns and mask mandates and all that sort of stuff. There are one side who thinks that masks are a breach of our civil liberties, and then the other side that masks are a must and it's how we keep ourselves safe and everything like that. So either side you sit on, there was so much conjecture during the pandemic and everything like that, and all this, and should we wear masks, even from the WHO and from Dr. Fauci, where don't wear masks. Wait, no, we have to wear masks. No, now we don't have to wear masks. Masks don't actually help. There's a lot of science that proves that it doesn't, that masks don't help. And then there's all this science that proves that it does help. And then there's not only are there maskers, there's double maskers now, and there's all this sort of stuff. So now, because this is a real thing that business leaders and political leaders, everything, all leaders of in all spheres are going to have to make decisions now. We've been through this turmoil of 3 years, coming out of it now, still most people still feeling the hangover from COVID, all the lockdowns, the mask mandates, everything like that. Now understanding what we know, now they're going back to things that were kind of proven, well, at least were proven unpopular, and if not proven ineffective. How do we as leaders make a decision now after there's been all this, let's say, there's a lot of misinformation from both sides, but how do we make a decision now, should we make our organization or make our team mask up? Should we make our team, go back to working from home? How do we make the right decision in this moment?
I don't even know how to answer a question like that, because I don't think you would apply a decision-making process to something like this any different to any other decision-making process. What are your first principles? What are the things that you're fundamentally driven by? And then what does the evidence around me tell me? I'm worried about what I'm seeing, and there'll be a lot of people who are confused, who are accused, I should say, of conspiracy. What I would say about what's going on in the world of podcasts and so on, particularly on the part of the more conservative presenters, I would say it's not conspiracy theory, but it's speculative. And yes, as leaders, if we're leading an organisation where people are in close contact, we might have to determine what our stance is going to be. I know what mine would be. I don't think masks are going to help. There's very little risk that people are going to die from this virus now, unless they are already at risk from any kind of respiratory illness. And obviously we need to do everything we can to look after those people. But I think, the whole thing has become politicised again, and this is one of this. I don't really consider myself a conspiracy theorist, but I can tell you this: given my experience during the COVID-19 pandemic, I've lost my confidence in the so-called experts and also in government and the public servants. I've lost my confidence in what we call in Australia chief health or chief medical officers, because I think their positions became heavily politicised. So I don't have the same level of trust post-COVID that I had pre-COVID.
Yeah.
And obviously, as a leader, that should be something I share with my people. I think with something like COVID, the real issue that leaders have to confront is, what if masks or vaccines are mandated?
Yes.
What am I going to do then? What am I going to do then? I wouldn't want to make the decision for another leader. I think this is something you need to sit down and prayerfully consider your position, prayerfully consider whether now is the time to say enough is enough. We are not going to tolerate these incursions on our freedom any further. I do think, though, that this is a decision that each leader has to come to. They've got to do it prayerfully. They've got to do it in the context of their own situation, their business, their church, or whatever organisation or group they happen to be leading. But I don't like what I'm seeing here. I don't like the fact that there are universities and schools in the United States now that are mandating masks. They haven't been mandated, as far as I know, by any local authority at this stage, nor by state authorities. But it just worries me, because there is absolutely no evidence that behaviour like that will save lives. It won't even stop people from becoming infected.
So, because there is this balance as a leader to, it's our responsibility to make sure we follow the rules of the land and obey and everything like that, And some would argue, okay, masks are inconvenient, but so what? So what if you have to wear a mask and stuff like that? But the question really comes to, how are you? Where does it stop? I think and that's what we saw through COVID, where we really realized, well, as soon as you allow one thing, it then opens up the door to another, and then all of a sudden we're down the track, being locked up. And kind of one of the reasons why I left Australia was we'd just had a son, and my family lived about half an hour away from us, and because it happened to be over some imaginary line, that my family weren't allowed to come and see my newborn son, their grandson, or their nephew, and so it's like, well, it's just a mask, but it's more than just a mask, isn't it? It's that whole, where do we draw the line? Where do we draw the line?
As a leader, yeah, you've got to know that. I think you need to know, what's my bottom line? When will I actually defy the authorities? Freedom is an intensely Christian concept.
Yes.
Because we're given the freedom by God to make the most important decision this side of eternity, which is whether or not to accept Jesus Christ as our Lord and Saviour. So our whole faith is based on the individual freedom that we have. And a lot of government interventions, of course, they make incursions on our freedom. We have to decide prayerfully how much incursion is enough or how much is too much. And then we have to act accordingly. And I think we have to be open with our people as leaders about the position that we're taking. So it has to be a principled position. And for me, I think it really goes back to the idea of individual freedom, how important it is that we restrict the freedom that individuals have to make choices as little as possible. There are some areas in which clearly we have to make restrictions. So I think it's reasonable that I should not be allowed to go and murder my neighbour,
Yes.
no matter how angry my neighbour might make me. All right? But in any case, there's plenty of biblical precedent for having laws like that. So I think the protection of property and so on that's not going to cause us to invoke our bottom line. But I really do think human freedom, where we stop people from maintaining their familial relationships, those kinds of things. As a Christian, for me, I worry about that a lot. And I think I would have acted quite differently during some of those COVID lockdowns, I think, if I had the same empirical evidence then that we have now. There's precious little evidence that locking down whole communities does anything positive.
Yeah.
And one of the things that really bothers me a lot is that if governments are now making plans to reintroduce mandated mask wearing and vaccines and lockdowns and so on, why are we doing that without having a serious review of everything that we did from a policy perspective during the first COVID pandemic?
Isn't
and
there...
and the other big issue is, why aren't we addressing the very real issue of excess deaths following the way in which governments responded? I think we need to, instead of worrying about, planning to reintroduce mandated mask wearing or vaccines or whatever, vaccine boosters or whatever, let's really dig down into the excess deaths that we're experiencing now and find out why are we having those excess deaths. Many people would speculate that there were people who didn't receive diagnosis or treatment during lockdowns. There was an increase in mental illness, particularly depression and so on. We need to investigate that because, and this is the economist in me, no decision is ever costless. There may be benefits, but there are also costs associated with it.
Yeah.
And I suspect that we paid a very, very high price for the way in which governments reacted to the pandemic. And I'm not at all convinced that repeating the policy is the right way to go. So that would weigh on me very heavily as a leader, as a church pastor, as a leader more generally.
Aren't they doing an inquiry in Australia? I thought they were.
I'd like to. No.
I thought
There have been calls for a royal commission, and I agree with that. We should have a royal commission, a very detailed royal commission. Not so much with the view of trying to throw people in jail. I don't think that's very productive. But learn from what we did wrong. And look, there's enough evidence to convince me that a lot of the policy decisions that were made for purely political reasons. They weren't made for health reasons at all.
Yeah.
I think there's already evidence of that, but I'd like to see that drawn out under the terms of a royal commission. But I think the focus should be, we need to learn the whys and the wherefores and the outcomes. But this just worries me so much. It worries me so much because, as you say, the price your parents paid for not being able to see their newborn grandson, in the larger scheme of things, okay, that wasn't all that much. However, you add that up across the whole population. I wasn't able to visit my parents for long periods of time, elderly parents, because they lived in New South Wales and I lived in Queensland. Again, that's not a huge price that I paid, because it meant that I had to delay my visits for months at a time, but I still paid a price, and that's
Yeah.
just not recognised. Those need to be recognised because they add up right across the population to a sizable cost. And then, of course, you have the incidents, or at least alleged incidents, where people's lives were lost because of border closures and so on,
Yeah.
where people couldn't receive hospital treatment, for example.
Yeah.
And, our state premier made an absolutely disgraceful comment at one time that Queensland hospitals are for Queenslanders. That was a despicable thing for any leader to say.
Yeah.
And I don't want to see us in a position where this could ever happen again,
Yeah.
ever.
You've kind of led off it onto a kind of different part of the topic, but actually still kind of on our topic of like, okay, so when we are leaders, we've gone into battle, we've had people follow us during COVID, forced to follow, the rules and everything like that. And there was consequences, there was persecution, there was suffering by people, and like you've expressed, there's still ongoing issues from it. It's important for us as leaders to make sure we reconcile that, or at least audit it and analyze and be really, really analytical of it, and just go, okay, so what mistakes did we make during this situation? What could have we done better? How could we change things? Because as you say, they're literally just opening up the exact same playbook, and like there's even campaigns going around and going, we're going to 2 weeks, 2 weeks to slow the spread. It's like, hold on a second, wasn't that the original? Original message?
We heard all of that. We heard all of that, and it didn't stop the jolly virus. I don't want to hear all that again. I really don't. But just one other comment, Craig.
Yeah.
In a situation like this, I think it's okay for us to say, look, I'm still trying to work this out, or I'm not really sure. In other words, we don't necessarily have to be the big, brave, follow me type leader. It's okay in a situation like this, I think, to say, look, I don't know, I really need some help. I really need some prayer around this. When does our compassion for young people who have their opportunities for social interaction stolen from them during a lockdown, for example?
Well, I mean,
when do we stand up against that and say, this is wrong, you cannot do that?
We talk about that all the time with my son. Like, he was a COVID baby. He was literally born like right in the middle of all the lockdowns. And
yes.
And we talk about it all the time. He now is different. And we all talk about it. Like, everyone with kids the same age, we're all like, they're a COVID baby. They behave differently. They are a lot more clingy. They're not as social. They like, he doesn't like leaving mummy or daddy. Like, he just, all of these. How is that going to affect him? But we talk about this, he's a COVID baby, and it's kind of thrown around as a bit of a kind of, slang kind of thing. But how is he, this COVID generation, how are they going to be in 10, 20, 30 years' time? We don't know that impact.
No, it's very hard to know. And it's not just babies either. I was on a Zoom call with a mother earlier this week who has school-aged children, and one of them had, and still is having, a real struggle to kind of reintegrate after long periods of shutdown. This was someone from Melbourne, which, as everybody would know, that Melbourne has the record as having the longest shutdown of any city in the world. And that's had an enormous impact on children in particular. And to the extent that this was politically motivated, it's an absolute blight on our political system, an absolute blight. So I'm concerned about any talk that we might reintroduce the same policies. And by the way, if you go back in history, the policies that were introduced in 2020 were so similar to those that were introduced in 1918, 1919, following the so-called Spanish flu epidemic at the end of World War I. What have we learnt since then?
So in
For
100
goodness
years,
sake.
yeah, what have we learned?
You know, the only
Yeah.
difference between then and now is back then people were deliberately infecting themselves or using the blood of dead people to try to create their own vaccines and self-administer and so on. It was just dreadful. But yeah, so we have learned a fair bit about vaccines and so on.
Yeah.
But you know, we don't know enough about the side effects of the vaccines. Quite frankly, there's emerging evidence, maybe anecdotal, but there's emerging evidence, and certainly some medical people are convinced that there are significant side effects, at least for some people. Most of us will know somebody in our family who reacted badly after a vaccine. Now, you cannot necessarily say the vaccine caused it, but what you can say with certainty is that symptoms appeared right after the vaccine. So,
Yeah.
you know, we need to investigate those. We need to be open to those things. And as leaders, of course, we need to do that. But for me, if someone came and asked me today, so what's your reaction going to be if we reintroduced mask mandates and so on? Today, I don't know. I'm still working through all these issues, but I'm particularly focused on the importance of individual freedom and that we should restrict an individual's freedom very reluctantly, and we shouldn't do it in a way which might have irreversible outcomes.
And we shouldn't do it for political reasons.
No, we shouldn't. It's just plain wrong. It is just plain wrong. It's very doubtful that we improve medical outcomes by mandatory mask wearing, especially outdoors, and by compulsory vaccines. I think if we make vaccines voluntary and make sure we do the research to figure out the exact nature of the side effects, then more people will take the vaccines anyway.
Yeah. And so on the theme of today, talking about following leaders, through persecution and what do we do? Well, as leaders, let's make sure we step back after a situation, after we've been through a major situation where people have been persecuted, people have suffered. Let's be analytical and really learn from it and see how we can change the way we're going to approach it next time. Make sure we're not doing things for political reasons. And political reasons doesn't mean you're running for office or trying to do something in politics. Political reasons could just be maybe you're vying for a position at your work, or maybe you're trying to impress the boss or someone to get a different position. But remember, make the analysis on what's best for the people you're leading. Hey, you've just watched an excerpt from the On the Cube Leadership podcast. If you liked it, give it a thumbs up. If it challenged your leadership or inspired you in some way, put a comment below. And if you want to watch the full episode or more content like this, check out our channel. And hey, consider subscribing while you're there.